Hi, and welcome back to Prescription for Primary Care. Today we are talking to Michelle Milheiras of the Happy Pelvis. Thanks for coming on the show today, Michelle.
Thanks for having me. I'm really excited to be here to talk all things pelvic health.
Tell us what Happy Pelvis is.
So it all started based off of my own journey with chronic pelvic pain. So my journey began many years ago with unexplained pelvic and bladder pain that just slowly crept over the years into every aspect of my life. I went from being pretty active and social to barely managing day to day. So like so many, I was told, oh, it's just normal part of being a woman. You're too young to be in pain is another one. And one of my favorites is wipe front to back.
Oh
As
my
as
God.
if that would solve my pelvic pain and my recurrent UTIs, as if I wasn't hygienic enough.
Oh my goodness.
So it wasn't until I was finally diagnosed with conditions like bladder pain syndrome, endometriosis, pelvic floor muscle dysfunction, lupus as well. But this was strongly like after I was advocating for myself to get in to see the right specialists. And things slowly started to make sense after that. And that wasn't until I was about 28 years old. And my pelvic pain started around 8 years old. So pretty much my whole life. And I'm now 35. The Happy Pelvis started out of my own journey and wanting to share my perspective of not being heard, not being listened to advocating, spreading education, how to better advocate for yourself in the doctor's office. My mission is it's really simple. It's to equip people with the right resources and tools for themselves to advocate in their appointments.
Mhm.
So I offer resources, toolkits that you can download that is a step-by-step guide to help you through a doctor's appointment. I really want to help patients make informed decisions about their care because that's something I personally struggled with
Yes.
on my own personal journey. So there's a lot of challenges that I've struggled with that I wanted to help others within the community.
There's a lot of similarities there with the advocates. So we were in the primary care system. We go to our doctors for help, and unintentionally or intentionally they can't help us because either they're overwhelmed, burned out, or they don't have the information. When you're in pain, you get creative, right? So you try to start to look around, do your own research, and just really advocating for yourself, know what to ask for.
Right.
That was in my case as well. And so what kind of challenges did you find in the primary healthcare system? So was it the same thing where your doctors like didn't know where to put you or you know, can pinpoint you basically?
Yeah, it sort of felt like a hamster wheel. Like I just kept going in with recurrent infections, chronic pelvic pain, do the same tests. All the tests come back fine.
Mhm.
Um, Having urine tests that are outdated and can't really narrow in on the actual bacteria. There were many challenges, but I think the most uh, prominent one, I would say, and it's at the primary care level and even specialist level, just has been the lack of the coordinated care
Mhm.
between. So I found myself being sent to specialist, but no one really was communicating with one another and getting like a full picture of my own personal health. So there's also a huge gap in like the provider education of these conditions that create pelvic pain. especially when multiple conditions are involved, because
Mhm.
someone can live with interstitial cystitis, bladder pain syndrome, alongside endometriosis. You can have fibroids. There's many conditions that can be the pain generator. So that was a big challenge, and having to self-educate and really push for those referrals. That's another thing, is pushing for a certain referral to a certain doctor. I noticed that myself and many other patients, they sort of hit a wall there. And yeah, so I ended up seeking out other practitioners who believe me. And I don't think it should be that hard. It should be a lot easier
Yeah.
than that. And when you're navigating this healthcare system while you're in pain, it's just a whole other layer of difficulty that we're facing. So
Mhm.
yeah, that's, I would say, is probably big piece of the challenges
Yeah,
that I myself and many others face.
absolutely. Navigating for yourself is hard when you're in pain. We notice that gap, where you have your like different, you're working in silos. We really want that integrated healthcare. You know, that was in my case as well, not with pelvic, but with other issues. So I have to really advocate for myself as well. And I basically became the touch point for everyone. So I had everyone in an email thread, phone numbers, everyone knew each other.
It's a full-time job.
Yeah, so I became like, I didn't care if they hated me. Screw you. I'm trying to get healthy here. And then once I get healthy, I'll be out of your hair.
Exactly. Yeah, that's how many of us feel, and that we face that struggle every day.
So the happy pelvis. So what kind of conditions for someone who doesn't know anything about, pelvic issues? What kind of conditions are we talking about here?
So a few of the big ones are endometriosis, and
Mhm.
that's when tissue similar, not identical. It's not the lining of the uterus. It's not identical, but it's tissue similar that ends up elsewhere in your pelvic cavity and throughout your body. And it's a whole body chronic inflammatory condition. And many patients are met with dismissal because of period pain being pushed under the rug. And like myself, many years of, oh, it's normal, take the birth control pill, keep taking your Advils. And that creates a cycle of chronic pain. And that is a whole condition all in itself. So like you said, is trying to get in to see the practitioner a lot sooner, and having that connection and the collaboration between the doctors is a huge piece. Another condition is interstitial cystitis, or also known as bladder pain syndrome. We don't know the cause, there is no cure, but more and more research is directing more towards our pelvic nerves. So going back to that inflammatory response, and creating a lot of irritation in the pelvis. Another one is our fibroids. It's very common, especially in the African American population, and individuals over the age of 40. However, they can happen at any age. I've talked to teenagers who have had fibroids. So there's many conditions, and then there's another one that is an interesting one that I was never aware of, is called pelvic floor muscle dysfunction. I was never aware of muscles within my pelvis.
Mhm.
I'm aware of every other muscle in my body, but that is when your body, your muscles, these pelvic floor muscles react to the pain that you're feeling, and they tighten up to try to protect you.
Mhm.
And so that becomes like an additional condition with somebody who's living with chronic pelvic pain, be it from endometriosis or fibroids or adenomyosis, which is another one.
My goodness.
There's so many conditions that are underfunded, under-researched, and underdiagnosed. They say they're very rare, but more and more research is showing that it is not rare. It is very common. It's just that it hasn't been diagnosed because patients haven't been taken seriously enough to be looked at.
Okay. Yeah, the pelvic floor. What did you call it? The pelvic floor
Pelvic
muscle
floor muscles, but it's pelvic floor muscle dysfunction.
dysfunction. Yeah, I haven't heard that one. I know about the pelvic floor and the Kegel exercises and all that.
Yeah, everyone knows about the Kegels, but there's so much more that I've
Mhm.
learned over the last like 5 to 8 years of this journey that I wish I knew when I was 15, 12, 13, 14. If I had the tools that I have
Mhm.
today, it would have made a huge difference. So that's another driving factor as to why I'm doing what I'm doing with the Happy Pelvis.
Mhm. Yeah, like when you think of that's so sad that when you think about 12-year-olds, 8-year-olds already experiencing that kind of pain, you have to wonder what's going on in society that's causing all of this. But I mean, thankfully we have advocates like you who recognize that and are already putting together materials and toolkits together for people who need help. Um, so, what what kind of advice would you give your doctors if you had a chance to just sit them like down in front of you? What would you just say to them, or what kind of advice or advice would you offer them to just kind of help this population?
Hmm. I would probably say, like just one word, listen, like
Mhm,
active listening. I feel that that's a skill that can be learned, especially as even if you might not have the personality as a doctor to connect with your patients, but we notice if you're actively listening, making eye contact, that's really big. And believing, like to believe your patients when they say that they're struggling with new symptoms, new pain. Try not to brush it under the rug. Investigate it because pelvic pain is incredibly complex and it cannot be solved within that 10-minute appointment slot and a prescription of a birth control pill. Sort of like slapping a band-aid on something, on like a pipe that's burst or something, and thinking that it's going to hold, and it just won't. So also making sure another thing would probably going back, like taking that multidisciplinary approach, having nurse practitioners be involved in the care, informing them, educating them, making sure they're trauma informed, and taking time to really just understand the conditions. New
mhm,
research is always coming up and popping up, and there are doctors doing good work. And I feel that a lot of doctors might be stuck with what they've learned in medical school, and there's like, it was a 1-minute discussion about endometriosis in their lesson. And
yeah,
because of that, they don't have that broad knowledge of what can be done now, what it is, what more information we know about these conditions. Yeah, so these conditions aren't rare. I want to emphasize that even more. They're not rare, they're just underdiagnosed.
my question was, why would doctors feel compelled to brush this kind of thing under the rug when a woman comes in and say, I have a lot of pain here, and when you're talking about it, doctors probably don't have a lot of education in it because historically it was all men, right? Before the women came in, and then the woman's world was very separate and very secretive, and you don't talk about that kind of stuff. So I'm obviously we have a lot more lady doctors and in healthcare, so it's coming out in the open more. But do you find that the so it is getting younger, would you say, for these pelvic conditions?
I wouldn't say they're getting younger. I just think that, like I said, it's just they haven't been recognized. I just feel that doctors now are looking a little bit further. There have been advancements in care, I would say, over the last few years, and more doctors are aware that this could be a possible condition, and knowing that, okay, I should refer this patient from my primary care to this specialist at this education hospitals here in Toronto. So I think younger generations are becoming more vocal.
Mhm.
Um, they won't take no for an answer, which is a very strong asset to have when you're advocating for yourself. Yeah, I don't think that they're getting any younger. I just think that they're underdiagnosed and they just haven't been diagnosed at a younger stage.
What has helped you? What kind of resources did you find that helped you in some of your symptoms?
So when I first started my journey, of course, everybody goes to Dr. Google and you type in your symptoms. And what it led me to was a community called Nancy's Nook. And it
Mm-hmm.
was a nurse practitioner from this, I'm pretty sure she's a nurse, yeah, nurse practitioner from the States, who was spreading proper evidence-based education about endometriosis. And she pretty much gave the guidelines on how you should advocate for yourself at the doctor's office. So that was like my first like dip of like, oh, there is a way to ask for more help and more support. So Nancy's Nook is a very informative website that people can go to. Also, another one is, there's a few. So there's one that actually just came out, and it's called periodpain.ca.
Okay.
And it's like the period pain is real pain sort of campaign that they're going with right now. And it's developed collaboratively through youth
Mm-hmm.
patients with lived experience of endometriosis and period pain, medical professionals like gynecologists, PCPs, pelvic floor physical therapists, and it's in connection with UBC, the University of British Columbia. So looking at this website last week or the week before, I wish I had something like this when I started my journey, especially Canadian content, because our healthcare system can be quite different from others, and we might need different supports.
Mm-hmm.
There's another one. It's a website that is useful. It brings together useful resources in collaboration with different gynecologists within the Toronto hospital network.
Mm-hmm.
And the whole goal is to improve the quality of care. And it's called Gynecology Quality Improvement Collaboration. So it's really great to see these things happening now. And then basic information is there's an International Pelvic Pain Society. So if you go to internationalpelvicpainsociety.com,
Mm-hmm.
you'll be able to get more resources. And what was the other one? Facingpelvicpain.org, I believe
Mm-hmm.
it is, or facepelvicpain.org is another great resource for patients to get accurate information about their health.
Okay. And the Happy Pelvis, because
Yes.
you've got and you've got a lot, because I'm looking at your Instagram account. You have like a huge following, like 16,000 followers. Which is
Yeah,
it's
which
amazing.
it just
And
shows you how many people might be struggling in silence. And yeah, like you said, I have a resource page, and where I sort of try to accumulate all of these like links and resources that it's all in one spot, so they're not going all over Google trying to find.
yeah, that's perfect. And like, I mean, you talk about really cool, like, most unhinged wedding day survival tips.
Yeah, I'm recently engaged, so I'm trying to plan a wedding around my chronic illness. So I'm trying to get the best tips I can.
Oh, that's awesome. And then you talk about period pain, and you have pop quizzes, and I mean, it's fantastic. It's free resources. And let me see, I'm just checking it out quickly. Free pelvic pain resources. You've got a website here. You've got a little shop. You have the ultrasound toolkit, which is probably handy, and the doctor appointment toolkit, as well as a newsletter and a blog and your own podcast. So called the Happy Pelvis.
Yes.
Great.
A
Wow.
labor of love. That podcast is a labor of love. Like I mentioned, I sort of put it aside because I had other balls in the air, but
Mhm.
it's something that I'd love to get into, and I'd love to interview you about Healthy On and like figure out like great topics that we can share with the community,
Mhm.
because I see the work you're doing. I see the goal, the end goal, and the end goal is to help patients improve quality of care, and that's all a patient advocate really wants to hear is at the end of the day, the patient comes first.
Yeah, we love our advocates. We take everything they say, we learn, and we put it into our big plans, and we all have our own personal experiences with this struggling healthcare system. So yes, I mean, I'm so grateful that you're able to have this interview with us, and we can learn about what you do. Um, so is there so we're just going to end it off here. Is there any final words you'd like to say?
Um, don't give up. Know that there's many others who are standing alongside you, who are struggling with the same thing, and know that there are answers out there.
Wonderful. Thank you. And all of your socials and your email and website will be in the show notes as well for our listeners who want to reach out to you. I want to thank you again for coming to the show, and thank you to our listeners for listening to this episode of the Prescription for Primary Care. Please like, share, comment, or subscribe to our channels. And until next time, good health and better healthcare.